questions with regards to that, I'm sure Fabrice, Lionel or Elvira will be able to answer any of your questions. So to begin with, what we'll do is we'll start with a short video that we've got all about kind of what is RCHIS. So what I'll do is I'll play this video now for you all.
So there is no sound. Hello, hello. There is no sound. You didn't switch when you connect on the session. Lauren? Okay.
Apologies, there seems to be no sound for a number of you. Let me try and play it again.
Still nada.
There's an option somewhere, I can't find it anymore. There's an option somewhere where you have to say, I think it's when you share your screen, you have to click a button.
Deployed to bring medical staff, equipment and supplies to support the National Federation.
Video again from the beginning. Apologies everyone for that technical issue.
Of Red Cross and Red Crescent societies is the world's largest humanitarian network, providing assistance to millions of people affected by disasters and crises. Following a disaster, emergency response units are often deployed to bring medical staff, equipment and supplies to support the local Red Cross or Red Crescent in responding to the medical needs of the population. Now, there is a new initiative that is transforming the way we are supporting medical services in emergency situations. The Red Cross Red Crescent Health Information System is a digital tool that allows doctors, nurses and other medical personnel to manage patient information and individual care along every step of the patient journey. It's been designed specifically with the emergency humanitarian context in mind. The interface is intuitive to use, so it can adapt easily to local needs, and teams can start using it quickly. Minimal setup is required to get it operational, and it functions offline. And the system is modular, so it can be tailored to work in a wide variety of scenarios. The health information system benefits everyone. It helps the patient by ensuring an accurate and secure record is kept of their needs and treatments, improving their overall quality of care. It makes the clinician's job easier by streamlining reporting, increasing accountability, and encouraging better collaboration with other care providers. It strengthens the health facility by allowing program managers to better plan and manage staffing and material needs. And it improves the big picture. Multiple emergency response units can all use the same application to share information with each other, including possible early identification of disease outbreaks. Reports can be compiled easily and shared with local partners and headquarters. Health information collected in the community can even be integrated into the new system, allowing us to better understand the bigger picture, and we can adapt our services to meet evolving needs. The health information system allows a much more coordinated and collaborative operational response. And although designed for emergency environments, it's also available for use in other healthcare contexts. Developing this health initiative has been a collaborative effort, bringing together many Red Cross and Red Crescent partners along every step of the way. The health information system improves the way we work and helps us all to deliver the highest quality medical care to people affected by disasters and crises.
So I hope that video is giving you a little bit of an insight into what RCHIS is, and we're obviously going to go into a lot more detail about it, as well as do a bit of a demonstration at the end. So thank you as well to Elvira and the IT team for sorting out the technical difficulty as well. And I just also need to let you all know that we are also recording this session now as well, which we can then disseminate to you at the end if you want to pass this session on to colleagues. So if we talk about actually how did we come up with this idea and how have we gone around developing an app? It's all very easy saying that we need something, but how does the process go from talking about it to now actually having a physical product at the end? So it all kind of began back in 2015 when a need was identified to improve how we work in ERUs, with particular for patient information, electronic medical records and health information systems. So initially there were landscape analysis that were conducted basically just to determine how we're best to go forwards with this, who we should involve and overall how we should go around this. So there has been a big collaboration between ourselves in the emergency health team at IFRC, the IFRC IT department, national societies who have been bringing in absolutely fantastic support and expertise, as well as working incredibly closely with our external developer, Atos. So again, as I said before, how do we physically get this from an idea in our head as clinicians into a way that then app developers who aren't clinicians and who aren't medical can actually develop something that's really functional? So to go around this, there's been a number of workshops to help design and also improve modules of RCHIS, and one most notably recently we've done with the German Red Cross, where we've taken their expertise and their experience within maternal and reproductive health, gathered a big group of people, including some external partners of theirs, to sit down for a number of hours with us as the emergency health team and our IT team to then further develop and work through and find what we need and what we're missing and how we can improve it. So one way we go around designing things, as you'll see now in the little film that is playing on the laptop screen, is we make something called wireframes. And this is something, if you want more detail on it, the IT team can step in and talk about it, and in particular Elvira can, which is where we take what we're talking about as clinicians saying, well, we need to see the observations of a patient, but how do we get that from what we want in our head onto paper? So we sit down as a team and we design it, and we've actually been using PowerPoint for this. So you can see there's a lot of information on that page where we're putting all the boxes that we need in there, lots of descriptions, so that when we're taking it to the developers, they can then bring that and put it onto the page for us. And really important while we're designing this, we need to think about how it functions as an app, not only so it's really intuitive, but also it's very easy to train people on. You know, those of us who are sitting in the office all day, you know, we have unlimited time to be able to kind of play with it and train on it. But when you're actually in the field and you haven't got very long to train a local staff member or someone new who's rotating into the ERU, you want to make it as intuitive as possible so that we're not having to spend hours training people on it. So the whole purpose of the app is that it all kind of functions the same throughout, so that it's really easy to get to use. And those of you that have had to play on it already have actually fed that back to us, that actually it's incredibly easy to use very, very quickly. The also advantage of having an app like RCHIS is that multiple users are also able to view and edit the patient record and the patient journey at the same time. With a paper record, you have one copy of it, and you'll be having to pass it around from the person who registers the patient, then to the triage nurse, then to the doctor, to X-ray. And it's very easy to lose that bit of paper and lose all of that information. However, with an app-based interface like RCHIS, is the nurse can be doing the observations on the patient and logging them at the same time that the doctor's writing up his consultation, the same time as the lab and X-ray techs are processing the tests and the X-rays that they need. So it's overall rounding that patient journey so that things can be done kind of simultaneously and together without that risk of having losing those vital bits of paper with all of those patient information bits on. And leading into that, there's this synchronization between, you know, if we're then requesting some lab tests, such as blood tests on the app, that's then automatically synchronizing to the person in the lab with their app open as well. So that patient's popping up on their screen straight away, and they're then able to do their test and process it without delay. And when we're thinking about that as well, we have to think, what should people be allowed to see about that patient's journey in the hospital? And beforehand, with paper records, if you've got all of the patient's details and all of their history in one place, you can't just block those bits of information out. So within the app, what we've done is we've designed it so that depending on the user, that depends what you can see. So the person who's registering patients in, who, for example, might be a volunteer, they can only input the patient details. They cannot edit, they cannot view any of the patient's confidential information from their consultations. And it's the same with people who work, for example, in PSS, work in the lab, work in X-ray. They can only see what is required of them as well, which very much sticks to patient confidentiality and not sharing information unless it's absolutely necessary. There's also the ability of viewing the results immediately. So if the lab has processed some blood tests on a patient and inputs the results, it will automatically pop up on the screen when you then go back into that patient. So you're not having to wait for bits of paper being passed to you or a result being given to you over the phone. It works very, very quickly and just updates as you go. And as well, I think importantly for a lot of you is this automatic generation of reports as well, which is being done within the app. So beforehand, at the end of a day working in the ERU, you would probably have to sit there for a very long time doing your MDS report by hand. Now on the app, it will do that automatically for you at the click of a button. So that's one big advantage with this, is that a lot of your reports are going to take you an absolute fraction of the time. And this then leads into another point further down the line, is we're now able to create reports to actually work out how we can better care for patients within an ERU. So this is an example of one of the functionalities within the app, is to see the observations very intuitively. You click open graph and then it brings up the graph of the observations there, so you can actually see the trend of that patient. And overall, why are we here today? You know, this whole week is all about digital transformation. We know it's within, you know, the IFRC strategy 2030. And so it's important that we recognise it within this app. And other big things is that this is completely fully customizable to meet the needs of any ERU. So whether or not you're a mobile clinic, a fixed clinic or a hospital, you can completely change what is inside the app. You can customize the lab test, you can customize what wards you've got, how many beds. So it's not just a static, you know, one size fits all, it's completely customizable for your needs. And we've mentioned before is that actually this is you're able to store your medical records within this. So instead of having to give the patient their records to ensure then that they bring them back next time or store them, they're stored automatically either within the tablet or within the server, which then means if those patients are returning, whether they're inpatients or they're coming back for things such as wound dressings, or pregnant women, for example, coming back for antenatal care, their records are automatically kept within the app. So you can bring that patient back up again and you've got access to all of their notes from their previous consultations and their previous visits, which as a clinician is absolutely vital, instead of having to retake all of that information or having to scramble around to actually try and find where you put that bit of paper last time. As well as RCHIS is, you know, ever expanding. You know, as it mentioned in the video, it mentioned about having the ability to do medical stock management and things such as CBS. So these are modules we currently don't have within the app, but in the future it's something that can easily be expanded to be used within the app as well. And the nice thing about this is that I'm sure our lovely IT department can go into this in much more detail and describe it better than I can. But with the technology that it's using, it's ensured that it can actually be used offline and as a sole unit. So we're not having to worry about the need for Wi-Fi or internet in remote places. But if you've got more questions on that, I'm sure one of our IT team can answer those later for you. And as we mentioned as well in the last slide, the reporting element of it, which is, you know, very important for your daily reports that you're required to do, but also it's improving that quality of patient care. So those reports are allowing us to constantly learn and improve, because we're allowed to analyse that real-time data in an easy way without having to sift through hundreds of bits of paper and collect it on an Excel document or collect it by hand. We can get automatic reports showing us what we're treating, how much of each diagnosis are we seeing, so we can see trends in what's happening throughout the ERU. And really, really importantly, we need to kind of understand, why is this improving patient safety? So it's quite startling, really, that patient harm is the 14th leading cause of global disease, which is comparable to TB and malaria. And when we think of, the big campaigns behind TB and malaria, we don't always see the same for kind of improving patient safety. So we've said a number of these points before, is that this is a really secure way of collecting and storing all of that confidential information. And it's also allowing us to then bring back that information and look at it, which allows for a much better continuity of care for these patients. And if we're thinking of people that are coming back multiple times throughout the deployment, whether that's for antenatal care or care for a medical condition, wound care, etc., it's improving how we can then care for them, because we've got all their notes in front of us. It's also increasing the accountability for clinicians as well, because if it's recorded on the system, it's going to stay on the system. And one of the big things that we're then including within RCHIS is the ability to actually report incidents that happen with the ERU as well. And this is really, really important, because not only does it allow the ERU to then learn from these incidents as well and analyse them in depth and work out, how can we not do this again? And it also then gives people the accountability to report them as well, and report them in a, in a confidential way within the app as well. And we've already mentioned reports, and we get real-time observations and clinical charts as well within this, which is really important. And it would be fantastic as a clinician, because you can stand at the back and you can access every single patient's chart from being away from them. You're not having to stand at their bedside, find the obs chart, find the clinical notes. It's all just in front of you. So if you need to remotely review someone's chart, you can do that very, very easily. And as well, we're just reiterating the same point again, is that we're getting really quality reporting from the app as well. And this not only assists within the ERU deployment, but afterwards, which allows us then to audit what happened during, and then what can we improve and better on deployments going forwards. So what we'll do now is we'll give you a demonstration of the app. So this is a pre-recorded video I recorded a few days ago of a screen capture of the app. So what we're going to do is we're going to follow a 28-year-old called Harry Potter, who has fallen off a roof and he's landed on his left arm, and he's come to the ERU by himself and he's in a lot of pain. So first of all, we're going to log into the app, and then the screen that it comes up here is the screen of all the patients within the ERU, which you can then filter down. But we're just going to add him as a new patient as the registration person. So this is where you input all of your patient data, and you'll see at the top of the screen he's already been given his patient identity number as well. And one of the particular clever things with this is it allows you to use a map to then locate. So in remote places where there aren't, the traditional addresses, street names, etc., you can actually get someone to finger point to where they are, and it puts in their geolocation of the app, as well as collecting all of their necessary data. So we've got different options here for how people come in, whether they come in by ambulance, they walk in as well, and just a quick brief description of the purpose of their visit. And if he was a female, it would ask her, if she was pregnant as well. So here we start filling in our vital signs. So this section would not be allowed to be seen within the registration person, but within nurses and physicians, they're able to do this. And what happens is once you fill it out, it will then pop it into a graph for us as well, which you'll see in a second. And then if we come down to our triage as well, this is where we, do our traditional triage. Are they category 1, 2, 3, 4, which then also when we go back to the main screen, what that does is it shows people on there by their triage number. So the people who require the most urgent assistance are always at the top of the list. So now if we fill in our allergies, you'll see at the top of the screen as well, is that actually the allergies will come up in red and in bold at the top of the screen, which is really, really important as a clinician. It's a bit of a never event for us to ever prescribe or give anything that a patient is allergic to. And then just a little bit more about the patient's kind of history. And then under our consultation tab, this is where we actually write down the consultation. So here is the clinician. I'm doing my basic assessment of Harry Potter and his injury and his history, and putting in a little bit of his examination in here as well in my findings. And the nice thing as well with this section is that all the notes collect here. So if the person is an inpatient for a number of days, you'll see all of their notes very kind of neatly on top of each other here in a little box, and you can access all of them. So if you see up at the top there, it's currently got the notes that I've just written, which can't be edited again. So now we've got our body chart. So this then allows us to take photos. So excuse my desk at home. But if you've got anything you need to take a picture of in particular, for example, like a wound or a rash or anything, you can take a picture of it, tag it, and you can place it anywhere on the body as well. So what we're going to do is we're going to request an X-ray for this chap. So what we'll do is we just put a little bit of a name or description. We say what category it is, and we can always add comments. And then once we press enter, it gets sent to our X-ray techs, and then they can pick it up and organise their day appropriately and do the X-ray. So now we've got the X-ray user here. So this is me playing the X-ray tech now. So each person has their own logins and passwords as well. So as you can see, this is the X-ray queue, which is a lot smaller than the other queue that the physician could see. So they're only seeing which patients they can. And as you can see, everything is blocked out. So they can't add or take away any information that isn't related to their role. So you can add pictures on here. You can take pictures again on the X-ray. However, because of the physical size and kind of detail that X-rays actually are, X-rays from their original program aren't being uploaded onto RCHIS. So the technician can write their own little notes. So whether they had any issues with actually producing the X-ray or if there's kind of anything obvious on there. So X-ray done, physician contacted to view, and result, there's a clear fracture. And then once they've done, he's gone off the screen. So now we've decided that Harry does indeed need an orthopedic review for his very broken arm. So what we do is we come into here as the physician again, and we request one of our surgical colleagues to come and see him. So again, it's the same as requesting an X-ray. We pop a little bit of a description in, click enter, and then it gets sent off to the surgeon. So now we're within the surgeon's area. So again, their list is a lot smaller than the general list. It's got the patients on there that they need to see or perform surgery on. So you can see that under treatment and recommendations that it's now asking for the surgical assessment. So the surgeon can come in and do their assessment. So here they're saying it's a complex fracture of the left arm and it's displaced. And then they can decide whether or not it requires surgery or not. I'm afraid I'm not an orthopedic surgeon, so apologies if any of you are, and any of my orthopedic knowledge is wrong. So as you can see here, we can click the button saying surgery needed as well, which then has an impact on the surgical screen as well, showing that this chap needs to go in for surgery. So now we're going in for the surgery. So you can see there on the list, we've admitted Harry Potter to the ward for his surgery, and now we can add the intervention that is required. So for this, it will be an internal fixation of his left arm. And as well, again, you can see under here, we've got a category for reporting purposes. And this, again, very much kind of leads back into our reporting that we can then look at further down the line to see what surgical procedures have we been performing, have we been performing more major, more minor, etc. And then we click onto our surgery and it will bring up our preoperative, intraoperative and postoperative. So in our preoperative, we've got the ability to do the consent form within the app as well, where the patient can sign or the guardian of the patient can sign if they can't consent themselves. This will actually save onto a form, which we can then have a look at in the app, and it can even be printed out if required, as you can see on the screen there. And then we've got our other sections preoperatively as well, which currently in this form of the app aren't yet complete, but this includes our anaesthetist form and our preoperative checklist, which in our new version of the app, which will be coming out soon, will actually show the safe surgical checklist from WHO. We've then got the ability for the surgeon to write their report, and then she can take pictures as well if we need pictures of the wound or something in particular during the surgery. And then post-operatively, our surgeon can then write what is required for care for that patient back on the ward, and our anaesthetist can then also write any specific instructions as well. These will also be sent to our ward nursing staff within their section of the app as well, so that they can continue with that nursing care as well. But that is the app in a nutshell, really. So that is a very, very quick demonstration. So really, it's kind of telling you now what's going to happen next and answer any of your questions. I have got our app hooked up to my computer as well. So if you've got any questions about anything in particular, I'm hoping that we can get it to work so that we can demonstrate any particular functions that any of you want to see. So where we're going from now with this, we're currently in the stage where we're still developing and changing certain aspects of the app. So at the moment, we've done a bit of a haul over of some of the operating theatre stuff, and we did that big workshop with the lovely German Red Cross on our maternal and reproductive health. So all of these at the moment are kind of in line to be developed over the next couple of months with Atos into the app, as well as now stabilising the app so actually it can be fully functional and tested. So yeah, if any of you have got any questions at all, please raise your hand or type questions in the comments, and then either myself, Laura, or a member of the IT team can hopefully answer any of your questions at all.
I see a hand up there. Hussam, please go ahead.
Yeah, thank you. I have a question, like in case of emergency, like CPR situation. So what is what is the procedure here? Can they proceed with what's needed without going through all these steps, or can you just explain a little bit about it?
I can jump in if you like. Absolutely. So for the first iteration of the app, we have not made any fields mandatory for exactly that reason. We don't want care to not continue or people get slowed down by the app. Now, when things are entered into the application, they are timestamped with the name of the person who did that, who did the specific intervention. So what would happen during an emergency intervention, you can fast track registration, go straight into RCHIS or whatever you need to do. And then you have the capacity to go back as you would in regular life or in your day-to-day work at home, and backtrack and record what happened during the RCHIS or other emergency situation. So this is the plan for the first iteration, and then of course we expect that after the first chance to really deploy this during a deployment, that we'll get lots of feedback and change that. But for now, absolutely, the app never stops you from moving forward. Related to that is most profiles are not able to edit information once it's been entered. And this is related to patient safety, quality of care. We don't want somebody to make an error and then be able to go back and delete what they did to cover it up. Now, hopefully no one would ever do that. So in order to change an entry, that requires special permission with a very limited number of users who can do so, with an explanatory note as to why the change was done. I hope that was helpful. I see Kilma has a hand up. Please go ahead.
Okay, thank you for the opportunity. Good evening from this side, from Tuvalu. My question is, with the app, as I have seen, you can sign on the device, right? Does that app come with a special device, or which is suited with any device, especially I'm concerning about the signing part, please.
Elvira, would you like to jump in regarding specs and how we sign? It is just a finger on the screen, but Elvira, maybe you could support with a little bit more on that. Thanks.
So the signing is just a finger on the screen. So if you don't know how to write, you can do an X or, but that's a kid. What exactly is the question? I don't know what to say more.
Okay, my question is, does the app come with a special device, especially for the signature part? Because the devices we're receiving from this side, that's what. Or does the app already transform a device so it will be comparable with any devices that we have the app on, that we have the app inside the devices? That's my question.
Okay, so no, we use the internal, all tablets are tactile, so we use the tactile system of the tablet, so we did not add anything. Lauren didn't demonstrate it, but there's also a barcode scanner. So if you give a barcode bracelet to your patient, we use the camera of the tablet to read the barcode. So again, it's not an external device. The only external device that we're working on, but it's not fully integrated yet, will be a vein scanner, a finger. We're using just the finger, and it would serve to identify the patient. Oh yeah, there, great. The barcode scanning. So the only external device would be a finger vein scanner. So really small, you just put your finger on it, and really the size of a pack of cigarettes. And it will serve to identify the patient, and why not, for people who can't sign, a way to sign, because it would be a unique identifier. You can see on the screen you have captor vein and authorized vein, because so we don't have it yet, but the Atos team with whom we work is working on integrating this. Did I answer your question?
Yeah, thank you very much.
Thanks, Elvira. I see Sushanta has a hand raised. Please go ahead.
My question is this app is available at Google Play, or it is due for uploading your app?
I could jump on it. Yes, hello.
Thanks, Lionel.
Yeah, yes. So today not, because it's on the private storage, which is the FRC store, if I just make it simple. But later on, yes, it will come, because today we are finishing the apps, and when it will be in a few months, it will be as an app store, or it will be Google Store, or whatever, because it will be store related to the technology you are using as a mobile also. Okay.
Did that answer the question for you?
Yes, I understood. Thank you.
Okay, perfect. Thank you. Thanks, Lionel. I don't see any hands. Let me check. I don't see anything. I'm thinking of IAM data things. Is there an API or a link to reporting figures to extract for sit reps and for things like that? So this is a question from Rachel. So this is looking at APIs, links, and reporting. So absolutely. So one of the most important APIs, although it's technically not an API, but one of the most important links that we've developed for RCHIS is the ability to export data into DHIS2. A lot of ministries of health are using DHIS2, and a lot of quite a few organizations are using DHIS too. So we wanted to be sure that we can communicate with those partners. The other thing is, in terms of sit reps, is we're currently designing quite a few different reports that will be automatically generated. So one is the minimum data set, which is required daily by the Ministry of Health during most sudden onset disasters for sure, or emergencies. So that is automatically generated and can be printed or emailed to be submitted to authorities, depending on the process in country. The other reports we're developing, we're looking at a few different target groups. So one group would be people working in the actual clinic or hospital who want, at the end of the day or week, to review what's been happening. So this would be aggregated reports looking at number of surgeries, how many lab tests, what type of service, bed occupancy rates, all kinds of different indicators that are helpful for both senior medical officer positions who are looking at clinical aspects, as well as team leads, deputy team leads who may be, or jointly looking at management in terms of, do we need more staffing? Should we anticipate ruptures of key supplies based on what we're seeing? So a few different reports are being automatically generated in the app for that target group. The other target group is the deploying national society. So people sitting in headquarters may want to look at the current performance of the ERU, how busy are things, do we need to anticipate sending an extra rotation, various things like that that will be useful during deployments in terms of managing and tweaking our response, and also after deployments in terms of using full aggregated data to report back to back donors in terms of number of people served. We're looking at incorporating indicators specifically with reporting in mind, and it's been an interesting balance in terms of collecting maximum data for reporting, but not collecting so many data points that it becomes too heavy for the users. But certainly looking at some of the usual questions that we want to know at headquarters or back donors in terms of, are most of the people coming, are they coming for disaster-related treatment, or are they coming for a longer-term treatment? Looking at things in terms of how many people are repeat visits, why do they come back? Looking at for different indicators for reproductive health in terms of how many women are coming for more than one antenatal visit. So there's lots of interesting things happening on that. And then the final target group is really that back donor, which is similar to headquarters, although at headquarters we may be more interested in day-to-day ops, whereas donors are often more interested in final outputs. Finally, the last thing regarding data is you are able to build customized reports. So if what we've built does not meet the needs of individual national societies, all data points in the app, it is possible to export the data in basically an Excel format if you wanted to do your own pivot tables, your own analysis. So we are currently building all of those aspects. If anyone does have specific needs, tips, experience related to reporting, either from a data visualization perspective or data set perspective, please feel free to reach out to Lauren or to me, because we'd love to hear that now when there's still a chance to integrate it into the current version. Hope that was helpful. Thanks.
Maybe I could jump, because there is one question which could be a technical question. There is a question from Kim relating to technology development, availability to add a new features and all things. What I could say that the platform has been built as a service-oriented, so like that, it's a microservice of the technology for who could understand. It's completely configurable, and you could have new features and new functionalities. I could say almost on request. Of course, there are some development if you need new features, but the platform is open and ready to be adjusted and configured. Thank you.
Thanks, Lionel, for jumping in. I see Rhea from Finnish Red Cross has a question. Please go ahead, Rhea.
Hello, everybody, and thank you for great presentation. This is really important issue for all of us that the RCHIS is proceeding. I have asked the same question already before, and I'm asking again that it looks like that there is sex and age disaggregated data available, but the disability, for example, PGI minimum standards says that we should have that kind of disaggregated data, and then also our back donors, and of course for the care purposes as well. So what is the status of that part or information? Thank you.
Huge thanks, Rhea, for reminding us of that. Lauren, maybe you can complement. I know we did. So basically what happens is the health team designs things and then it's translated and then it's built. So there's a bit of a lag between request and build. So it looks like Lauren's opening up to see if that's been built just yet. I don't believe it has been built, but it has been requested and is one of the what we call a user story. Where it's been designed and planned. That said, Rhea, as it looks like it has not yet been integrated into the app, interpersonal violence. If you have an example of the correct terminology or another, reporting methodology where this is done really well, please do let us know, and maybe I'll reach out to you, or Lauren or I will reach out to you on the side to follow up on that really important point. So not a super clear answer, but thank you so much, Rhea, for the reminder, and a good reminder to double check and make sure we get it correct as well. Thanks. I see Kilma, is that a leftover hand or do you have another question? Please go ahead.
I have one more question. Just in addition, first of all, in addition to Rhea, thank you for bringing that up. That's the question I really wanted to ask because I do have a brother that's disability at the moment. Anyway, another question I wanted to ask with this app, because it's looked really, really interesting. What I really wanted to ask is, when you are querying for medical doctor, for example, like if you're migrating and you need medical certification, would that be possible? You can do it from home instead of going to the hospital and be checked, and then you send you your medical certification inside this app, or do you still have to visit the hospital due to the time and busyness in between and all those things? And my last thing is just in addition, while you are still working on upgrading the system, yes, please do include disability. It's really important. And the last thing is, please, when you fix this, please be mindful of the areas like where technology is not really upgraded yet, like on your side. Thank you very much. And yes, those are the things I want to comment. Thank you. And ask.
Thank you for your question. Lauren, did you want to grab that one or should I jump in? I feel I'm jumping a lot. Maybe I'll jump in and Lauren or anyone else feel free to compliment. So I think regarding your question in terms of the ability for a clinician to access and integrate something into a chart remotely, practically that would be possible. So for example, right now we have some people testing the app from North America, while others are in Europe region, and the tablets are syncing. So it is possible to do that. That said, we have not integrated any formal telemedicine, any formal type of remote consultation into the application. But in terms of being to access remotely, I think the ability is there, and the question would be more about policies, legal aspects, operating procedures. But tons of things that really can be integrated down the road. Regarding your comment about disability and integrating into the app, very well noted. Thank you very, very much. And similar to my request to Rhea, if you have expertise in this area and have either terminology or data sets that would be most appropriate, please don't hesitate to share with us for integration. I hope that was useful. Yeah.
Yes,
perfect.
that was really useful. Thank you very much. And yes, I would also like to contribute on the disability. If you can email me, then I can contribute on the disability side. Thank you very much.
Thank you so much for your offer to contribute, and absolutely we will reach out to you via email after the presentation. I see Angela has a hand up.
Yes, hi, I have a question. First of all, thanks for the really good work. I really like this app. And I wanted to ask, so in general, when will, I think that the question was answered before, but I didn't hear the answer sadly. When the app will be finished, or like just around, you think, like more years or only more months? And is it then like open source software? So is it free of charge, or do you have to pay for it and it is available for everybody?
Thank you very much, Angela. So in terms of timeline, I'm very happy to say it's months, definitely not years. So we're right now doing enhancements, stabilization, and what's called a penetration test, which is where you have an external company try to hack into your app and make sure it's absolutely safe. So those things are happening over the next few months. In parallel to the app development, we're also developing quite a substantial piece of work is developing training, both for what may be super users or someone who has the opportunity to do training pre-deployment, as well as training packages designed more for on-the-job, just-in-time training for the large proportion of staff who are hired actually during the emergency and don't have the opportunity to train in advance. So we're working on training packages. We're working on standard operating procedures. So everything from where should tablets be charged? How do you sign them out? How many do you need? What do you need to charge them? How do you deal with a lost tablet? All of those questions will be in both training manual, user manual, as well as standard operating procedures. And we're also working on an IT user guide, which is more of the techie bits in terms of setting up the system and how do we customize for deployments, how do we store on the cloud, how does that whole piece work? So it's ambitious, but we're hoping to have the full package done within 2021. But even sooner than the end of the year, it certainly will be ready for extensive testing. We've had some conversations with national societies hoping to do ERU trainings this year, if COVID allows, and we're really excited about and aiming for those opportunities. So if anyone listening does have opportunities for a large-scale testing, do please let us know. The other thing I'll mention is we do have a register of volunteer testers. And what we do is we contact these people and arrange one-on-one remote testing sessions or sometimes group sessions to get really valuable feedback as we go, because it's better to get it right in the design phase versus fix it later. So it is another call out. If you have people, they don't necessarily need to be clinicians, but clinicians are for the large part the target group. That you think would remotely support, please do let us know. In terms of, is it free? The idea is originally this app was designed with global tools, ERUs in mind. So we use the term ERU a lot. It's really designed through the lens of rapid deployment during an emergency for a short period of time. That said, the long-term vision would be for more and more national societies to use the app in domestic settings. To us, the more people that can benefit from this, the better. So to facilitate that, we have designed it in a way that it is super easy to translate into any language, essentially to have it customized. It's an Excel sheet is translated and then it's imported. So translation into any language is very simple. We just need to provide the actual translation. And it has been built with right to left and left to right functionality for various languages. Another factor that we took into consideration for more broad use is it is possible to have clinicians working at the same time in the same operation in a different language. And then their data can be aggregated and reports can be provided in whatever language you like. So open fields are one exception. So for example, if you enter data in an open field text in language X, that part will not be translated into language Y. However, all of the drop downs, all of the basic data can be translated and reported on. The one cost that would be associated with using the app is the actual hosting of data. I don't know, Lionel, if you can complement or talk a little bit about how that might work. I don't think we've fully worked it out, but Lionel, feel free to jump in if you have some thoughts on that.
Yes, we have some points on that. It could be not a lot. We are speaking 100 francs a month or something like that. So don't worry too much about that. Worry more on the functional level. Thank you.
I hope that was helpful, Angela. Did I miss anything, or was that helpful?
No, it was totally helpful. Thank you. Thank you very much.
My pleasure. Thank you. And I see Sushanta, is that your hand remaining, or do you have a new question? Please go ahead.
No, you have answered my question. Thank you.
Perfect. Thank you very much. Maybe I will pass back over to Lauren. Was there anything in the chat that we have not covered? And then if not, I don't see anything there. Please raise your hand if there's anything urgent. And then of course we're available. All of us are available for follow-up. But I will stop yapping and hand back over to Lauren. Thanks. Lauren, I don't know if you're...
In the meantime, I am just seeing a question that I think was not answered. It's a more techie one. So as I understood, every team member needs a password. Who will be in charge of setting passwords during mission? Is there an IT support during mission? So there will be support for the app on remote. And then for really, for setting up the app for each ERU, yes, we will discuss with each ERU team to see who has this role, but there should be the role of setting up the ERU for the RCHIS app for that ERU, because there are also settings like what's the name of the ERU, what is the address, and maybe there are some specific settings for, depending on the location, there are specific settings like a special rapid test that needs to be done because we're in a place where there's a lot of malaria, for example. So there is a small configuration part needed.
And maybe I can complement all of those types of questions in terms of how you use the thing will be covered in the standard operating procedures, as well as we're creating a user manual for project managers. Now, of course, what we provide will be the suggested way. We're building all of those based on consultation with various ERU national societies. So we will provide a suggested way with flowcharts and tools to help with management of all of that logistics around the thing. And then, of course, in the field, teams are most welcome to adapt based on the context, team size, competencies, that type of thing.
And just answering another question, so each person using the app will have his or her own login, because this is due to the accountability and the audit process. Everything entered in the app, there will be a way to trace that who entered it, and it doesn't have to be an IFRC email address. It can be any email address, but it will not be a generic login like head nurse. It will be first name, last name, blah, blah, blah. So we know who entered what or deleted. No, you can't delete any info actually in the app. So who modified, who entered that data, etc.
Perfect. I think that's all the questions. We are right on time with 1 minute left. Lauren, would you like to close? Or I'm seeing if we still have Lauren. I think there might be a sound issue. I will keep yapping. Well, first of all, huge thanks to Lauren. Lauren really put this presentation together. There she is. But I will jump in before you close to say huge thanks to Lauren. This is all on her, and thanks for letting us join you, Lauren. And I will hand over to you to close. Thanks.
Apologies there, my laptop put me on mute. So thank you everyone for coming along. It was lovely answering all your questions. I have put my email address up on the last slide, and I'll pop it in the chat as well. So if you've got any questions, or if you're interested in becoming a volunteer, or there's an area that we've talked about you want to help on, please just drop me an email, and then we can start that conversation from there. So thank you all very much, and I hope you have a lovely day and weekend.
Thanks, everyone. Take care, and don't be shy to reach out if there's anything we can do. Have a good day.